My name is Julia Rennick, and I'm an improvement advisor with Built for Zero for Canadian Alliance to End Homelessness. I have the pleasure today of introducing OS11, Stronger Together Community Partnerships. I'd like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters in which we gather today. Tiohtià:ke, Montreal, is historically known as a gathering place for many First Nations. Today is home to a diverse population of Indigenous and other people. We respect the continued connection with the past, present, and future in our ongoing relationship with Indigenous and other people from coast to coast. Today's session is highlighting the successful cross-sector and cross-community partnerships. Please help me in welcoming Rachel Putt, Manager of Housing Policy and Homelessness, and Caitlin Beaton, Program Manager of Homeless Prevention for the City of Edmonton, and Ashlyn Prokop from Indwell, and Sarah O'Connor from the City of Hamilton. They will be sharing their strategies for building inclusive, collaborative approaches to ending homelessness. There will be a question and answer period after the presentations, and I'll ask you to come up to the microphone and use the microphone to answer your question. Thank you.
Do you want to come stand with me?
Hello, everyone.
Thank you for joining us here on the last day of the conference. We were walking down the hallway to the very end of the room, and I was like, there's going to be 4 people in this room. So we are pleasantly surprised that you are here and very grateful that you're choosing to spend your time with us. As mentioned, my name is Rachel. My pronouns are she, her. I'm the Manager of Housing Policy and Homelessness at the City of Edmonton. I come into this work with about a decade of experience, first in nonprofit work, doing public education and some fund development. I worked in a political office with a focus on advocacy on permanent supportive housing, and I've worked for the city administration in affordable housing and homelessness for about 7 years. My team is responsible for the delivery of the city's affordable housing strategy and also work around the Homelessness and Housing Services Plan, which is what we're here to talk about today.
And good morning, my name is Caitlin Beaton. My pronouns are also she, her, and I am the Program Manager of Homelessness Prevention and Response, and I come to this work for over 2 decades, starting like frontline day shelter all the way through to developing and strategy and programs to end homelessness.
So Julia opened us with a wonderful land acknowledgement for here in Montreal. I want to share a little bit with you about where we come from in Treaty 6 territory, also known as Amiskwichiwiskagan, which is the Cree name for Edmonton, called Beaver Hills House. It's a gathering place for many diverse Indigenous peoples, including the Neha, Dene, Anishinaabe, Nakoriska, and Niitsitapi peoples. It's also the traditional homeland of the Métis and one of the largest communities of Inuit south of the 60th parallel. I'm very fortunate in my work, Caitlin and I both, to work with a lot of brilliant Indigenous leaders from First Nations, Métis, and Inuit communities. And it's with that spirit that we are able to do our work every day. Did I do it? Can you help me with that? Okay. All right. So like I said, we're going to be talking to you about the development of the city's first homelessness and housing services plan, or a corporate homelessness plan today. And I just want to start with a bit of context about Edmonton, where we're from and what the need looks like. So Edmonton is growing faster than most other parts of the country. Between 2022 and 2024 alone, we welcomed nearly 140,000 new people to Edmonton. We're a young city, our population is 3.5 years younger than the national average, and we're a diverse city. About 40% of people identify as racialized, and Edmonton is home to the 2nd largest and fastest growing urban Indigenous population in Canada. But when it comes to housing, the shortage of affordable housing is acute. Edmonton has been regarded as somewhere that is relatively affordable, and that may have been true, especially prior to the pandemic, when medium income was roughly enough to afford a resale home. But that fact hides a pervasive inequality when it comes to core housing need. There are about 395,000 homes in Edmonton, but in 2018, only 15,000 of them were affordable. Like the rest of the country, we're playing catch up on affordable housing after decades of disinvestment from all orders of government, like we heard from Minister this morning. As a result, Edmonton has a higher percentage of households in core housing need and disproportionately high percentage of people in severe housing need relative to other cities. According to our housing needs assessment, nearly 1 in 4 renters are in core housing need, and it's 1 in 3 for Indigenous households. Of course, from an equity lens, not all people face the same risk of housing need and experiencing it. Racialized renter households experience the greatest need in our city, followed by 41% of senior households and 22% of people with physical disabilities who rent. So those pressures, population growth, housing shortage, systemic inequality, especially since the pandemic, have influenced the increase in the number of people experiencing homelessness in our city in a big way. Edmonton's by name list, pictured here, is managed by Homeward Trust Edmonton and represents people who are experiencing homelessness and accessing housing services. In August of this year, over 800 people identified that they were living unsheltered or in encampments, with 4,000 others either in emergency shelters or couch surfing and staying in places without fixed tenancy. It's important to note that people who are not engaging with service providers on housing are not represented here, so this is likely a smaller number than the actual number of people experiencing homelessness in our city. In a dramatic oversimplification, for the sake of time, it's clear that housing services in our city far outweigh the ability of the housing system to respond. At a structural infrastructure level, I'm going to quote one of the panelists that I heard from yesterday, for housing first to succeed, you need housing first. Despite municipal, provincial, and federal investments that have resulted in an increase in affordable housing units from 15,000 to about 18,000 units today over the last 5 years, the demand for affordable and appropriate housing, including supportive housing, remains. I'm going to take us back in time. This is not how it always was. In 2008, the homelessness and housing crisis in Edmonton had reached historic levels for the first time, which led to one-time funding from the government of Alberta to develop affordable housing and the establishment of Edmonton's first plan to end homelessness. Is there anyone from Edmonton in here? No? Okay, great. Nice to see you. Under this plan, Edmonton adopted the Housing First model and a coordinated systems response led by Homeward Trust Edmonton, who distributed funding from all orders of government to community-based organizations. Through this work, the number of people experiencing homelessness was reduced by nearly half from its peak of over 3,000 people in 2008. So during this time, the City of Edmonton played an adaptive role by coordinating some services and initiatives that connected unhoused Edmontonians to supports, collaborating with the sector and communities on research and planning, and providing limited funding to Homeward Trust to further their mandate. For a Canada-wide audience, I think what's important to note here is that the City of Edmonton does not receive operational funding from the federal or provincial government to address homelessness and does not have devolved authority to assume the responsibility of housing, like in Ontario. So we're really we sit on the outside as a convener, a coordinator, a researcher, but we don't actually have funding levers to deliver housing programs. Like other Western Canadian municipalities, we have a bit of a unique approach and as a result have a clearer history of our role and responsibility as a municipality on the housing development side. Since the 1960s, the city has developed, owned, and operated housing, worked with the federal government to provide land for investment in social housing, and it even established a nonprofit housing corporation that today operates about 1,200 units of mixed market affordable housing. Today, we continue to play that critical role through the provision of land and grants to housing providers as a first-in investor in order for them to access funding from other orders of government. We're not going to delve into that today, but I just share that in the event that you're interested in it. It's just happening adjacent to the homelessness work that we're talking about. So in 2017, the City and Homeward Trust published an update to the plan to end homelessness, identifying a renewed focus on community-based solutions, including the need for more supportive and bridge housing, enhancing prevention and diversion strategies, and improving system coordination with a focus on long-term solutions and affordability. The number of individuals experiencing unsheltered homelessness and living in encampments was on the rise and very visible and talked about a lot in many different circles in our city. Given the solutions identified to address this problem were layered and multi-jurisdictional, integrated work was needed between all orders of government, First Nations, Homeward Trust, and community-based organizations, including Indigenous-led organizations, to pilot and test new ways of supporting people with complex needs. Bam, COVID hits. So in 2020, like many of you have probably experienced, the pandemic hit, and regardless of traditional roles and responsibilities, all orders of government and the sector had to pivot to this emergency response. For the city, this meant a lot of uncharted territory. The expanded response shifted to a corporate-wide effort, evolving to nearly all departments contributing to emergency activities for folks experiencing homelessness. We became a direct service operator, utilizing our major major conference venue as a 24/7 medical recovery unit and day services hub, where city staff were redeployed to support frontline workers. When that closed, the city's football stadium became a temporary overnight accommodation where city staff managed operations. The city also became a significant financial player. So what you see on the slide is a snapshot of how city funding, some but not all of it flow through money from other orders of government for pandemic purposes, were used to stand up temporary emergency shelter and bridge housing. We also funded day services as additional spaces for people to receive services and supports to address both rising rates of homelessness and the constant fluctuation of spaces due to social distancing and outbreaks and all of that stuff. So in fall of 2022, the feds lifted most of the COVID-19 restrictions. Funding for the public health emergency stopped flowing from other orders of government. But as everyone in this room well knows, the pandemic impacts didn't just disappear. At a local level, this resulted in a tension between the need that remained in community among public servants that recognized the massive gaps in service delivery, municipal funds that were quickly running out, and louder political conversations about jurisdictional responsibility. In addition to this, the drug poisoning crisis has long been contributing to worse health outcomes for folks experiencing chronic homelessness, requiring clinical support that was already stretched way too thin. So in May of 2022, the Office of the City Auditor released a report that assessed the city's response to ending homelessness. Unsurprisingly, the audit found that the city's efforts to be complementary to the sector and flexible in its response were really helpful, but resulted in some questions around effectiveness, roles, and responsibilities. While admittedly at the time, I was quite burnt out and a little bit affronted that the city auditor chose to audit the city's response on the heels of a pandemic, what this actually presented was a tremendous opportunity for us to step back, reassess what our role was in the system, and consider how we could do some proactive planning in this space to actually benefit all of our partners working in community. So I'm going to talk a little bit about plan development before I hand it off to Caitlin to talk about implementation and impact. The first step for us was gathering a really thorough inventory of the types of activities the city did corporate-wide that had an impact, whether direct or indirect, on people experiencing homelessness. Our team conducted internal engagement with city staff across 27 business areas, including Edmonton Police Service and Edmonton Public Library. This engagement revealed a wide number of initiatives that achieved different but related outcomes that our team then analyzed and subcategorized into 3 themes: activities that prevent homelessness, contribute to resolving homelessness, or respond to homelessness in a variety of ways that address the immediate needs of people in crisis and the corresponding public space impacts. Sorry. This analysis also translated into city spending on homelessness, which gave the project team a better understanding of where we might have greater realms of influence and responsibility, and helps to bring clarity on the city's role in this space. So as you can see, that light pink bar on the graph is where we spend a lot of our money in the prevention space through a provincial partnership called the FCSS program. So we deliver funds to community organizations to deliver prevention programming. And obviously in the crisis response space, the City of Edmonton funds a program called Reach 24/7 Crisis Diversion. It's an alternative to an ambulance for folks who are in distress but not in need of medical support to be redirected to shelter or another space of their choosing. So those sort of like crisis interventions that aren't necessarily contributing to housing outcomes but are necessary in keeping public spaces safe and also protecting folks who are at risk of exposure or other like basic needs emergencies really is where we spend the majority of our time. And that makes sense, right? Because as the system planning organization and the community entity, Homer Trust and all of the organizations doing Housing First and housing support programming really fall into that middle bit. As an unrelated aside, if you are ever tasked as a municipal servant with doing a costing of homelessness, please come talk to me. I would be happy to give out my information. I know councils and municipalities across the country are asking this question, especially if you don't receive Reaching Home funding. And it's complicated. And as far as I can tell, there are not a lot of municipalities willing to do it, or at least do it publicly. So recognizing the expansion of the city's role in the space over the last 5 years in response to a number of unique circumstances and a need for role clarity moving forward, the Homelessness and Housing Services Plan articulates our ability to make systems and policy changes as a coordinator, convener, advocate, and limited funder in housing and crisis response systems. Being clear about where we have direct levers of control, like through our funding or the Municipal Governance Act, versus where we have influence was important in setting expectations about how the city can work collaboratively with partners moving forward. We don't have time to dig into everything else that went into the plan, but I do want to highlight that engagement is missing from the rolled up summary on this slide, but with good reason. In order to be respectful of people's time and input and to avoid the practice governments often have of over-engaging vulnerable people for information that we already have and we already know about barriers and systems because they've been interviewed again and again, we leverage previous findings from engagement with people with lived experience and the homeless serving sector that was conducted for the Affordable Housing Needs Assessment and Affordable Housing Strategy, plus concurrent engagement that took place for an update to the community plan to prevent and end homelessness that was led by Homeward Trust. Some insights from folks with living experience that can directly be linked to actions in this plan include the need for increased diversity of temporary and permanent housing choices that address the cultural and unique health needs of populations, that there needs to be increased housing supports for folks to both access and maintain their housing, especially as it relates to homelessness prevention, and that folks in need of housing see themselves as problem solvers in difficult circumstances, and there are opportunities for unique point-in-time interventions and restorative practices that can help to prevent housing loss and repair relationships, especially as it relates to tenancy and homelessness prevention and eviction prevention. So in July 2024, Edmonton City Council approved Edmonton's first homelessness and housing services plan. It outlines the city's commitments under 3 goals in homelessness prevention, resolution, and response, and has a corresponding performance measurement framework to evaluate what we're doing to ensure it is efficient and effective. For me, this plan was a realization of the potential the city has to increase the effectiveness and accessibility of city-funded prevention programs, and Caitlin will speak a bit about the impact that we're already seeing in this space. The other thing it does is realize how municipalities can work with community to identify and communicate housing and policy solutions that require collaboration across orders of government and the sector. While we may not be a funder in some spaces, specifically around housing support programs and health services, we are as a public service equipped to build out recommendations for what Edmonton needs that are aligned and supported by the sector, and to carry those ideas and the evidence that supports those ideas into rooms where we're speaking with other orders of government. With that, I'll hand it over to Caitlin.
We're not going to go into like all the details of the plan, but if you go to the City of Edmonton website and you Google Housing and Homelessness Services Plan, there's a very pretty document that talks about all the actions, the 27 actions that were recommended. So after it was approved by council, it was my job, mine and my team's job, to implement the plan. So as you can imagine, and just for some information, the City of Edmonton has 14,000 employees and 73 different service areas. And so a lot of these actions fell into different service areas that we didn't have any responsibility or authority in. And so we had to create a system in which we could work across the corporation to implement some of these actions. An example would be a public washroom strategy, which would live under city operations, and they would fund and build and identify locations for public washrooms. So what we did is we created a accountability framework. And so the purpose of this framework was to facilitate the information and implementation of the plan across the corporation. We had a mechanism to report back on challenges, to implement the actions, leverage resources, and remove barriers and identify solutions, ensuring that there was clarity on what people's roles and responsibilities were. As part of the auditor's recommendation, we also had to evaluate the impact of the work that we were implementing to ensure that it was effective. So we had to create key performance indicators across the corporation and convince people to do their favorite thing, which is data collection. And then we also used it to maximize investment and also for advocacy during budgetary processes. So what you see on the slide here is our framework with an executive sponsor who has the vision-focused responsibility and strategic decision-making authority regarding budget decisions, strategic direction, and changes in resources. Then there is the management committee underneath, and they are responsible for implementing the goals, objectives, and actions of the plan in their areas. Committee members serve as advocates for the plan and are responsible for keeping their leaders in their business areas informed about the work, and they mobilize resources and align it. There are 11 members throughout the corporation that are part of this committee. The backbone of the implementation has been dedicated to a program manager or a project manager who's responsible for ensuring communication and integration between the executive sponsor management committee and working groups. The project manager works across the corporation to remove barriers to implementation and tracks and measures the performance of the plan. And then we have a data analyst who works to facilitate data-driven decisions, making alignment in performance indicators and continuous improvement. And then the light blue ring that is sort of like the middle one is what we call the Friends of the Homelessness and Housing Services Plan. They are key allies and champions of the plan. They are responsible for supporting their staff to implement the actions of the plan in their roles on the management committee. So to give you an idea, this image illustrates the many business areas across the city of Edmonton that are impacted by the plan. So I'm realizing it's kind of small, but it extends from community services, rec centers, police, city operations, real estate, safe and healthy communities, are like municipal enforcement officers. It's crucial to understand that while a wide range of individuals and teams are involved in the implementation, the management committee is not a representative body of everyone impacted. We intentionally had to strike a balance on the committee to have enough people, a manageable number of people with the deepest knowledge and appropriate oversight, combined with the necessary authority to move the work forward. There's nothing worse than being in a room with too many people and walking around, talking around in circles and not getting anything done. So, to actually implement the actions, we have formed specific working groups comprised of both internal staff and external stakeholders. These subject matter experts focus on critical areas such as outreach coordination, staff training on homelessness, prevention services, integration, and responding to problem properties. So the management committee was struck in January, and over the summer we did a midpoint temperature check to see how things were going for everyone. Because if anyone in this room has been involved in governance, you know that it's not always easy, and it can be complex, and you need to pivot and adjust as you go. So from our discussions, we came back with 3 clear themes that had emerged that we needed to address to implement for the implementation of this plan to be successful. One of the things that we were experiencing is feedback delays from the management committee. We observed we weren't always getting feedback in a timely manner on operational items. So to address this, we really decided to pivot and only bring strategic planning conversations and invite feedback on operational issues offline to those who were interested. Some people felt a disconnect from their core mandate and didn't see how it was always the direct tie to their work. So as you can imagine, someone working in ETS whose job is to schedule buses is like, why am I spending time talking about homelessness? But in Edmonton, we see a large number of people experiencing homelessness access transit services. So we had to work harder to ensure that the project manager was figuring out how this work intersected with other corporate strategies across the organization. And then again, in this work, we also heard that people were feeling overburdened. People on this committee were already very busy in their work, and they felt like the added burden on top of their obligations was leading to capacity issues. And so we really faced that like urgent versus important matrix dilemma that is so often found in this work. So in order to sort of address some of those things, we reduced the frequency and time of meetings. So it's crucial to remember that the scope of this work extends far beyond just the City of Edmonton. This plan is implemented through a multi-sector system that spans various levels of government and a dedicated community organization. So this is a picture that depicts all the partnerships required to implement the actions of this plan. So all of these homeless serving sector partners include groups like Bent Arrow, Traditional Healing Services, Bissell Center, Boyle Street Community Services, Jasper Place Health and Wellness, Enoch Cree Nation, Homeward Trust, Montana First Nation, and Reach Edmonton are the driving force, turning our collective vision into tangible results for those in most need. So one of the things, for me personally, one of the best benefits, because going back to Rachel's slide, you saw the diagram of all our involvement in all various facets. And as a funder or someone asking community organizations to do something, there was like a real push-pull, and there wasn't always clarity on what I could fund or couldn't fund. And like the name of this presentation, which is Rural Clarity is Kindness. The greatest benefit of this plan was people understanding what our work what we could and couldn't do, and where our goals were. So some of the successes we have had with our partners is we have a clear direction. Our partners now better understand the city's priorities on homelessness and housing, which helps align the entire system. Second, around funding. Before, our funding used to be very ad hoc and like crisis, and we couldn't always predict what money we had. And now we have funding. It's strategically and transparently allocated, giving our partners confidence in the process and ensuring resources go to where they are most needed. Third, we have increased accountability. We have clear expectations, which means everybody is better able to track, process, and deliver on results. And finally, data. Our improved data collection is critical. It's helped us identify system gaps that were previously hidden and is informing best practices across the sector. However, this work also comes with challenges. So first is the perception. We frequently encounter situations where people have different views on what the city should and should not be doing, and so this requires continuous communication and clarification. Also, we do have some less agility. As a large municipal body, we are inherently less nimble to directly fund small and emerging and urgent needs compared to some of our community partners. And third relates to influence. While funding is a strong lever, influence deep behavioral or systemic change within our established partnerships can sometimes be slower, especially when financial contribution is not the primary factor. So now we get into the fun stuff, and I get to talk about some of the successes we have seen in our plan. This shows our progress and around the different goals. So around homelessness prevention, we have been focusing on providing support so individuals and families do not experience homelessness. A key component is our Rent Ready program, a tenant education course which equips participants with the essential knowledges and skills required to secure and maintain their housing. This year, the city's Rent Ready program has experienced a 54% increase in participation. In 2024, a total of 385 individuals completed the training, while halfway through 2025, that number has increased to almost 600. In the last 3 years, over 1,000 people have completed basic and certificate courses. The success of the Rent Ready program is a testament to the strong partnerships we have. We collaborate with 2 community organizations, Bissell Center and C5, as well as Edmonton Public Libraries to deliver the program in community. Additionally, we have expanded the program's reach by partnering with women's emergency shelters and family violence shelters to ensure we are getting the information to people that need it the most. Another success is we have developed a partnership with the Alberta Residential Landlord Association, who recognizes the completion of a Rent Ready certificate course as a positive rental reference. This is a game changer for many individuals who might not have traditional rental history, greatly improving their chances of securing permanent housing. The participants themselves here illustrate the impact of this program. These insights demonstrate the program's practical and empowering knowledge gained through the program. We also launched a targeted marketing campaign, which you can see through the middle picture, which further raises the awareness across the city. And then our tenant support staff play a crucial role in also preventing homelessness. Over the past year, they've answered more than 5,600 calls from Edmontonians dealing with tenancy and housing stability. So this team provides essential information to tenants to understand their rights. And lastly, we have partnered with Homer Trust to establish a housing relocation team and to rehouse individuals and families living in problem properties that are no longer habitable due to health and safety violations. Since the start of the program, we have successfully rehoused 133 individuals, including 40 children. I'm conscious of the time, and so I will go through this quickly, but the City of Edmonton has an emergency shelter best practices guide that we use to engage with the Government of Alberta, who directly funds emergency shelter, to align best practices. In the last few years, we've seen more emergency shelters open up in Edmonton, and the guide has been used to inform the development of more accessible and population-specific programs. So now in Edmonton, we have an Indigenous shelter, another women's-only shelter, a pet-friendly shelter, which allows to improve accessibility for shelter guests. In addition to emergency shelter, we've also funded 171 units of bridge and transitional housing, and this supports the objective to address the diverse needs in our community as people work to secure permanent housing. The city, if some of you might know, but through other presentations, but we have funded Jasper Place Wellness Center's Bridge Healing Program, $1.1 million. And this program provides health and housing assistance to individuals leaving emergency rooms who would otherwise face homelessness upon discharge. The first site served 182 unique individuals between March 2023 and March 2024. And people that access this program see fewer emergency visits and hospital admissions. And it also helps them to secure permanent housing. So we also recognize in Edmonton that more than 56% of people experiencing homelessness are Indigenous, and the importance that culture plays in supporting individuals in their healing journey. The city has funded Montana First Nation and Wichiwa Muskokamik Society to establish Indigenous-led outreach teams to assist unsheltered people. Their area focus is on rapport building, cultural support, and pre-housing casework for people sleeping outdoors. And lastly, our goal on homelessness response focuses on ensuring people that are experiencing homelessness are safe. So one innovative example of this work is a partnership we have with Alberta Health Services called Healthier Together, and it began in 2024. We provide weekly outdoor services that offer direct health care such as wound care, STI, health education, and essential supplies to vulnerable people in a city park. This clinic has seen over 2,300 visits. Individuals utilizing this service primarily rely on emergency health care services, and so we are working to provide preventative health measures to improve the health and wellness of individuals experiencing homelessness and diverting them from our emergency rooms. To further strengthen our emergency response and enhance daily interactions, we are also proactively developing a corporate-wide training for city staff who interact with people experiencing homelessness. And so we want to ensure that people whose primary job isn't or experience is in homelessness, that they have the skills and knowledge to be able to interact with people safely and effectively. We are doing a preliminary rollout of this training early in 2026. And this is to ensure that our staff, city staff, are working from a trauma-informed way. So some key learnings, and then we'll pass it on to our friends from Hamilton, is that governments are not community entities, but they still play a crucial role in partnerships. We also have been working to set expectations and create transparency helps to enhance collaboration and impact with our partners. And lastly, flexibility is the key. The environment is constantly changing, and the local government is best positioned to step in and fill where there are gaps. So thank you for listening to us, and after the next presentation, I think we'll do questions.
Thank you, Caitlin and Rachel, for your wonderful presentation from Edmonton. So now we'll hear from Ashlyn and Sarah from the City of Hamilton and from Indwell.
Oh.
No, that's the PDF.
Great job, guys. Thanks. Oh, thank you. Hi, everyone. I'm Sarah O'Connor. I'm a senior project manager with the City of Hamilton in our Housing Services Division.
And hello, everyone. My name is Ashlyn Prokop. I'm an advanced practice lead with a focus on social work with Indwell.
So I'll get us started off. Ashlyn and I are here to talk about a permanent supportive housing building in our community and the collaboration and partnerships that we took to get there. So first I'll give a bit of context about our community and the need, and then Ashlyn will get into the building itself. So Hamilton's homeless serving system collaboratively works across prevention and diversion programs, drop-in centers, housing-focused street outreach, emergency shelters, transitional living programs, and permanent supportive housing to help people that are experiencing homelessness receive the right supports to secure and stabilize their housing. And all of those partners that I mentioned work as a part of our coordinated access system. So what that means is that we utilize common approaches across all of our partners for intake and consent, assessment, and prioritization. And so this really allows us to take a community-based, person-centered approach to make sure that people have the right supports. A key pillar of that coordinated access system is our common database that all those partners use as well. And through the collective use of that database, which is HIFIS in our community, we know that approximately 2,000 people are experiencing homelessness in Hamilton. And so we fill our city-funded housing supports through by name data generated from HIFIS that align with the different program eligibility for those housing supports, and then also our community prioritization criteria that we've developed. So we're continually working with our community partners to understand the gaps in the system and where further supports are needed to end homelessness. So through those discussions and through analysis of our data, we know that Indigenous, Black, and racialized groups are overrepresented in the population of people experiencing homelessness in Hamilton. And we also know that people with high and very high acuity being the level of need or the severity of their situation with respect to housing, represent over 1/4 of the people experiencing homelessness in our community. We also know that permanent supportive housing can be an effective housing intervention for people with high and very high acuity. So the city's been considering the area of permanent supportive housing over a number of years, and King William, which we're here to discuss today, represents our second city-funded permanent supportive housing building. The building has a focus on people experiencing homelessness with high acuity that are Black, Indigenous, or racialized. So King William takes 100% of referrals from that coordinated access system working across our homeless serving sector, as I mentioned. And it's been a great example of collaboration between us at the City Housing Hamilton, which is our social housing provider who owns the building, and Indwell, who provide the supports at King William. So I'll turn it over to Ashlyn to talk about the building a little bit further.
I'm going to give you this. I'm going to have Sarah do my slides so I can focus on my stuff. So thanks, Sarah, for introducing the context. And so now that we have the local context, we have the need, I'm going to further the conversation by introducing Indwell. And further, I'm going to highlight the partnership, our beautiful building, program design of King William Flats, some of the milestones and the themes and some of the program successes. What I do recognize is there's so much to talk about when we introduce a project like this, and so our intention is kind of to overview the high level and then speak into any questions during the Q&A, with definitely a desire to consult or engage with anybody that we can have learnings back and forth with after. So I'm hopeful that one of the things is I actually stay right on the microphone so that you hear me the whole time. That's going to be my first goal. But my second goal is that I want you to understand who we are. And so you may have attended one of my awesome colleagues' presentations already, but for those who might not have, I'm just going to introduce who we are as Indwell. Meet people where they're at, and I need to be over here. So for 50 years, Indwell has been providing supportive housing that transforms lives. And every door that we open becomes a solution to homelessness. A little bit more about us. We support over 1,200 tenants in 7 regions across southwestern Ontario, and several projects we have under construction or in pre-development at this time. We empower tenants to achieve health and wellness goals and to constructively engage with their community. Our mission is what guides us. So Indwell is a Christian charity that creates affordable housing communities for those who are seeking health, wellness, and belonging. How do we do our work? We do our work in a values-driven way. These 3 values on the screen are our core values. They inform every decision that we make: love, dignity, and hope. Thank you. Slide. Amazing. So partnership, that's what we're here to talk about today, right? This is the partnership that made this project possible. I think it's an amazing example of when a municipality and a not-for-profit come together. And so you can see with the graphic on the screen, King William Flats, that's our program. And around that, you have our 3 key players or partners. So Indwell at the top, we also have the Housing Services Division, and then City Housing Hamilton, which Sarah mentioned. That gives you a good idea of kind of how we wrap around that project and we work together, because at the center of what we're trying to accomplish is meeting the needs of individuals, and so we draw it as a circle. The things that I want to highlight before I introduce the beautiful building is what are some of the things that we were considering in this partnership when we came together. 3 things to kind of summarize would be engaged partners, strategic planning, and collaborative execution. And so I'll give a little bit more to each of those. Strong partnerships are the foundation of success. I think we're learning a lot about that at this conference and seeing the value in partnership. Engaged partners, so both the city and Indwell, were committed. There was mutual respect throughout the project, a willingness to work through very complex challenges together. This kind of engagement allowed for that open communication that you can only hope to be happening, creative problem solving, and a shared ownership of the outcomes. It ensured that the housing solutions that we were developing through this partnership were truly reflective of the community needs, while balancing some of those operational, the financial, and the regulatory responsibilities that we all know are also part of this process as well. When you think about strategic planning, the early and coordinated strategic planning between the operator, being Indwell, and the municipality is critical in a project like this. A shared vision, a clear alignment on the goals, help to streamline those approvals as you work through a lot of that complexity, and leverage the funding effectively in the ways that's needed. So strategic alignment through this also position the project to more broadly respond to the municipal housing strategies that were already in place, and some of the social service priorities. And then lastly, the collaborative execution. So once that vision was set, collaboration in the execution ensured the project moved from that concept to reality. Joint project management, transparent decision-making, and coordinated communication across many different departments was and is integral to continue. So ongoing partnership in the pre-construction, the construction, as well as ongoing program operations, integral, right? To support that long-term success of the project, really with resident well-being being at the core of that. So reinforcing the trust and the shared accountability that we had in this project. We're getting pretty creative to do this. So what does the building look like? The building has 3 floors. There's 24 bachelor apartments, 5 barrier-free, modular design building, and it built to Passive House standard. Some trauma-informed design considerations went into the space. And as Sarah mentioned, the building is owned by City Housing Hamilton, with Indwell providing the intensive support services on site. What I also want to highlight on this slide is one of the other things really love about our partners, our partnership here at the municipality, is that creativeness in what we're doing. And so this project, where it was built, it was actually a parking lot. And you may have seen it in the newspaper if you follow some of the things that go on in Hamilton. And so the city said, well, let's look at the assets that we have. Let's see what the need is in our community. And this is aligning with the housing strategies that are in place. And how do we adapt to use this space creatively to bring more units online to support those who are experiencing homelessness? Slide. Thanks, I'm not giving prompts. And you're so great. This is more of the beautiful building. So you can see the front, you can see the back. We received the building around the beginning of October, and by the middle of October, we were starting to work through some of the referrals that we were receiving from City of Hamilton's coordinated access. Slide. This is a visual inside of one of the bachelor apartments. So, as I mentioned, we got the building at the beginning of October. We started working through referrals the middle of October. And then by November 6th, our first resident moved in. And that was really exciting. And proud to say that by Christmas, we had 21 of our 24 occupants living within the space. And our goal was, man, it's getting cold outside. How do we do this in a way that reduces barrier for entry while working through quite complicated systems? And so you can see each unit is fully furnished. Bed, side table, kitchen table and 2 chairs, comfy chair, in addition to essentially anything that an individual would need to kind of get started within their home if they've experienced not having a stable place to live for many years. Yeah, slide. So application and intake. Two things that I want to highlight. I'll let you read through the additional bullet points on the screen there, but I want to highlight that it was a really well mapped out intake process between multiple housing service departments, City Housing, Hamilton, and Indwell. It was also extremely timely coordination between the city and Indwell regarding eligibility, communication with referring partners, etc. Because again, the goal is to meet people where they're at, and if there's too much time between, people are in a different place, and so we want to meet them where we're at as quickly as possible. Slide. Few things to highlight within the themes of our intake and some future opportunities. So the three themes within intake were, it was very, very important when supporting individuals with high acuity and providing intensive case management, we needed a low barrier intake. Recognizing there are some things that are required when you're working through coordinated access, and there are ways to do that and be extremely low barrier in the approach. There was a persistence and commitment of the King William team that I'm going to talk about in a minute, as well as our community supports. So whether that was teams that were working with the homelessness serving sector or other partnerships that we made along the way, those additional relationships were also extremely valuable in ensuring the project came together well. And then a high level of support to ensure good transition. So that warm handover, right? The overlap in individuals that had been connected prior to and the individuals who are going to be supporting in the future. So future opportunities that we wanted to highlight, it could be, we have a commitment to point in time vacancy fulfillment, so having no wait list when units come available. We also have continued use of call for referrals via coordinated access. Slide. And so there's a lot of words on this slide, but this is our program design. What I'm going to highlight is everything that's on this slide and the way that we support individuals in their journeys is it's based on a therapeutic and rehabilitative engagement in an individualized service plan. So every support that you see on the screen is individualized to meet that person's need and integrated within where they are living. I think we'll leave it there for maybe 10 more seconds. Can you go back? Yeah. Take a browse. Okay, thank you. So this is where I get to brag about the amazing staff team that supported this project. While I get to be here representing the team and played a managerial role at the time of launch, the team was absolutely foundational in ensuring the supports offered to the residents were person-centered. And so this is what makes up our interdisciplinary staff team. We offer a spectrum of supports within this interdisciplinary staff team, but we'd have a manager following the project, a program supervisor on site, complemented by a housing team lead, 2 registered practical nurses, 2 psychosocial rehabilitation workers, addiction support worker, 6 housing support workers. It's a complement of full-time and part-time together. What this is actually very similar staff complement to our other enhanced programs that Indwell operates. The thing that's a bit unique with this project is because it's 24 residents, we're able to have almost a 2-to-1 staffing ratio, which allows for very intensive case management to happen. So again, we're supporting similar acuity level, we have a similar staff complement, but this program in partnership with the city allows for a 2-to-1 staffing ratio for individuals with complex needs. Slide. So a few things, and you know, we've heard these in the sessions that we're in and the importance of them, and I'm going to reiterate some, and some might be new for you. So highlights from the program design, relationship building. This is the foundation. Trust building. These are the 2 things that we as a program team focused on for the first number of months of somebody living at King William Flats. Safety, and I want to highlight real safety and also perceived safety. Does someone feel unsafe? How do we work through that and meet them where they're at? Ensuring representation, There's a diverse population that's living at this program. And so the importance of having staff reflect the resident population and ensuring that there was diversity and representation through every single intake and staff interview that we completed through the project. Ensuring culturally appropriate supports and being extremely mindful when you aren't the one to consult on what appropriate means, and bringing in other voices and individuals that are leading in this sector to be able to complement and consult on what we're doing. And having integrated supports all in one place. And man, that's what Indwell does. And so if you haven't heard about Indwell, indwell.ca, but talk to us about that, because that is really important. It's integrated, it's all in one place. It reduces the barriers that we all see our folks encounter when trying to navigate complex systems. And building community within our space, and building community with our neighbors who are around the space. And so those are some of the highlights. What I'm hopeful you take away from that is the intentionality and the values-based decision-making that went into our project, and really what guides the work that we do at Indwell, and in conversation with our partners as well. Slide. So the residents, who are we supporting, who is living, whose home is this that we're talking about? Because at the end of the day too, we remember this is someone's home. We want to share information in a way that's also respectful of the individuals that are living there. And so I'm going to give very vague or broad information. We provide high level of support. Sarah defined acuity, right? We say the term acuity if someone's worked with SPDAT, but it's that high level of support. That's an individual has otherwise not been successful in traditional models of housing and is experiencing chronic homelessness. Relationship is the foundation to everything that we do, and it's the starting point for everything. So the trust, the rapport, that's what creates the lasting impacts for our tenants or our residents, depending on the program. And there are transition phases, which means that the residents' needs inform the program design, right? If someone's coming in and they're in a phase of survival, well, we're not gonna move to integration, right? We're gonna focus on the survival needs first. We're gonna meet people where they're at, and our program design is gonna be informed by the needs within that community, and it needs to be flexible enough to do that. And there are many guiding principles and theories that informed this work. Being person-centered, again, taking those relational approaches, but also things like having a recovery lens, focusing through harm reduction, intersectionality, equity and inclusion, utilizing frameworks, the psychosocial aspect of it, and really prioritizing asset-based community development. Slide. So this is where I wish that I could have a whole presentation on all of the successes that have been experienced, because really, one, the project is just a success and it's something to celebrate. But when we get to see the experience of the individuals that are living within the housing and the steps that they're taking towards their own health and wellness, wow. So what I want to highlight is low barrier access, therapeutic persistence, and advocacy. That's 3 terms that I've used to describe this project anytime I'm talking about the project. So a few of the things that I will highlight, and happy to chat with anybody about some of the specifics if I don't mention, is we have accomplished our residents have experienced 100% housing stability and 100% have maintained occupancy. That's amazing. What that means is actually 88% of our people who are living there have lived there for 10 and a half months or longer. Keeping in mind that the beginning of November of this year, we celebrate our 1-year mark. What that also means is almost every one of our 24 folks that we support, this is the longest period of housing stability that I've experienced in the last 10 or 15 plus years. And so hearing that from each person has been so impactful. Crazy. 100% of the individuals that we're walking alongside have completed and are actively engaged in individualized service plans. And 80% have completed full health assessments with one of our RPNs, or the other 20% are in partial completion. Remember, persistence, therapeutic persistence. And our medication program has grown 10 times since we've launched, which means that we've seen an increase in connection to both oral and injection medication, supporting individuals on their journey. and psychiatric care. While we recognize there are many barriers within all of our communities to psychiatric access, we have had actually 6 of our residents complete full psychiatric assessments since move-in, and I would say that is a direct reflection of the efforts and advocacy of our team members on that interdisciplinary team, and the willingness and engagement from our residents to come alongside us as well. And external support teams. So many partners. Extension of service was provided, warm handers were provided. It's amazing the things that you can do when you work in a relationship and create that shared goal. Slide. So this is my last slide. I highlight some of the lessons learned and future opportunities. So lessons learned. Just this project was built with intentionality, right from the beginning and through to the end, and we ongoing adjust with intentionality. Relationship and collaboration, having a shared vision within the Hamilton context, and drawing on our strengths and defining our role. We're a not-for-profit charity. We're working alongside our awesome municipality, and that means we do work in very different ways. But we need to establish what strengths do each of the partners bring to the table, and let's define the roles that each is taking on. And developing shared language. Again, when you are partners who work in similar but different ways, it's important to have shared language and to pick up on the things that might mean something different in different contexts. So clear communication, no misunderstandings, and flexibility. And so I saw some of our learnings reflected in your learnings, and that means that there's real value in what we're all sharing today, because the future opportunity here, everybody, is to replicate it. And so I end it there, and thank you all for hearing about our project and our partnership.
We're going to open up for Q&A. So if you have if you have a question, if you can come to the microphone and just pausing for time here.
Good morning. Thanks for your presentations. Just a quick question for Idwell. You mentioned acuity. 28% of your folks have high acuity. What tool are you using to measure that with?
100% of our folks would be high acuity, like of the 24 individuals. The municipality uses SPDAT as a prioritization tool. And so individuals that we're supporting do span between a few SPDAT categories. We're also recognizing part of our role is to complete assessments upon move-in to kind of understand the accuracy of the assessments that were completed prior to ensure that as we come alongside that individualized support, we're also catering the support to the true need at that time if the prioritization tool was completed at a different time, if that makes sense. And so individuals, if you are familiar with SPDAT, I would say, without having the number in front of me, I believe it's about 40% of our folks are at a 13 plus on a SPDAT score. So if you're familiar with that, that would be a high level of support.
All right. Thank you so much.
Thanks for the question.
I have a lot of questions for all of you guys, so maybe I'll ask one. Sit down, come back. My first question, I guess very specific. So the Indwell project, it's permanent housing? Because I feel like, I mean, just like, I guess like I'm thinking, I'm like, okay, so it's long-term, because it's quite a high level of support. So is the idea that folks will be able to be like a little bit more like on their own eventually and be able to transition to other housing, or is it kind of like not even really on the table? What's happening there?
Yeah, it's a great question. So Indwell provides permanent affordable housing, and that looks different depending on the project. So for King William, we are going to support people living at King William Flats as long as they are benefiting or requiring that high level of support. If an individual is progressing and gaining more skills to live more independently, we're yeah, we're celebrating. And I think that's the value of having an organization that prioritizes a spectrum of supports within our housing. And so while I've spoken and introduced an enhanced model today, we do have other models with lower levels of support. And so in partnership with the municipality in completing our agreement, we talked about being able to transition individuals into, market rent housing with subsidy, or transition internally to another INDWAL program. And I think that's value added in partnering with a not-for-profit who has additional and spaces to do that. There are definitely times that we're going to work with other community agencies as well to transition individuals. What I didn't highlight was actually 2 of our folks of the 24 have already submitted internal transfers, with one pursuing that prior to the end of the year, which is really exciting to see.
So it's like a low pressure.
There's not like, hey, you got to do this in 12 months or see you later. It's let's meet you where you're at, while we recognize that providing that high level of support for an extended period of time, we want to see individuals align with whatever their goals are. And so maybe someone does need that kind of support, or support them there.
It's a connected question. Sorry, using this as my same question. So people can come in if they're user, they use drugs, alcohol, anything. Is like anything goes basically in terms of intake. I didn't quite understand what that means. I don't know this word. Whatever it was.
Acuity?
No, the other thing.
Coordinated access.
I don't know. There's a bunch of terms I've never heard before. So yeah. Low barrier. I don't know what low barrier means essentially.
Yeah, and that's a good question, because low barrier actually means so many things that I could probably do another whole separate presentation on. And so I think it's to our best of our ability, removing barriers that are existing for people in creative ways, working within a system that often doesn't put the person at the center. We see that. And so we get very creative. I could give an example would be, most of the individuals we actually met with for intake, 5, 6, 8, 9 times are somebody moved in at 2 a.m. Somebody completed their intake in 6 sessions instead of 1. Somebody didn't get their taxes filed. And so we're going through these processes. And so it's finding the things that are actually preventing people from being able to obtain whatever they're trying to obtain, and then reducing the barrier to access. And so I'd be happy to have an offline conversation about additional ways that we've done low barrier, but really anything that popped up, if that was a need for them and it was preventing them from moving forward, we did it. So we also did intakes at a variety of different locations, like in community, at shelter, with other staff. We provided food as an incentive to come to an intake and say, let's have a shared meal where we have this conversation. So I think it's understanding when you're in a space of survival, what do you actually need? What are you looking for? And how do we create this relationship in which we know we have support to offer, and I understand that you know the most about yourself to be able to engage well with me in a conversation. Tell me what you need and I'll help you get there. So that indirectly answered your question, because it means a lot of things, low barrier. Sorry, and harm reduction, yes. We meet people where they're at, and so there would be nothing that would disqualify someone from being supported in our program outside of not wanting to be there.
I have a question that's probably a little more relevant for the municipal folks up there. I'm visiting from Nova Scotia, and certainly that jurisdictional question has been something that's been really top of mind. And so I'm just curious if you can talk a bit more, maybe Edmonton more than Ontario, because I think the responsibilities are a little different there. Just about kind of that initial starting point of how the municipality kind of got involved and chose to step up, and how that's shaped, or how that's working with the province in Alberta, where there are some of those relational needs or challenges, opportunities. Decide how to frame it. Thank you.
I can start if you want.
Okay.
That's a very good question. Are you where you're from, are you a part of are you the CE, or are you sort of like a municipality that is I don't know what the funding structure looks like for you.
I would say that the province would have most of the responsibilities in Nova Scotia, and municipalities are the ones who are kind of seeing it. And so just that kind of starting point of being a point of challenge?
Sure, yeah. Okay, so like one of the components of the plan that we presented was that financial analysis piece. So I'm sure that you have probably heard from your mayor and council, well, what is the cost of doing nothing? And that question gets asked over and over again, but there is an inherent challenge in trying to identify the cost of doing nothing because you can very easily stigmatize people experiencing homelessness and overinflate costs that are related to other safety concerns that are being experienced by municipalities across the country. So that was one tactic, was when we went out to talk to the corporation about the cost of homelessness. We said, if homelessness didn't exist, would you still do this work? And that really helped us to like narrow the scope of exactly what we were talking about. So you're not going to find things, in like the roll-up of our financial costing that are just like broad safety initiatives. They are specifically things, they're like encampment cleanup and like extra duties that happen in the river valley to keep things safe, that kind of thing, in addition to like the crisis response. And the reality is that municipalities do have to deal with the consequences of doing nothing. And so giving, I would say, one of the most powerful pieces of advocacy that we could give our elected officials was to try and cost that out in a way that balanced those risks, because we didn't want to also stigmatize this whole group of people and say these are, crime is this entirely, because it's not. So the costing analysis was one piece at getting at that jurisdictional question. Obviously, like there are lawyers in your municipality who will have a hot take, so you would want to consult with those folks. And understanding the context and the history, like I just think that municipalities need to be flexible and adaptable and responsive to the needs of their citizens. We're governed by the Municipal Government Act and I don't remember the phrase off the top of my head, but essentially like it's our responsibility as a municipality to do what needs to be done to keep people safe and to have communities be livable. So in that, there is an inherent need for the municipality to respond with things like we have a community outreach transit team that pairs peace officers with social workers from Bent Arrow Healing Society, like Caitlin mentioned, and their primary goal is to be in public transit spaces and to talk with vulnerable folks who may or may not be experiencing barriers to housing. And that's a need that we're addressing in community because people have identified, Edmontonians more broadly, that they feel unsafe in transit spaces. And so I think that there is no like black and white, this is yours, this is mine. Like we all play a role. And so it's just understanding what your role is and pulling together some of the evidence to help support the scope of that.
Hello, thank you all for sharing today. My name is Gabriel. I'm from Quebec, Table de Concertation en Itinérance de Sherbrooke. I know it doesn't translate really well in English. Concertation is not quite the same concept in two languages. I was wondering about the Edmonton Municipal Action Plan. I was looking at the actual draft while we were talking. And I saw that you consulted a very big diversity of stakeholders, and there were multiple steps back and forth. But I was wondering if at the drafting process, at the table, were there a representative from the community or these different stakeholders also there, or was it fully drafted by the city's employees before being presented at the city council?
That is a great question. So we develop it concurrently to the community plan to prevent and end homelessness that was being led by Homer Trust. So we leveraged each other's engagement findings. So in the context of our community, the community plan was sort of the evolution of the 10-year plan to prevent and end homelessness. And it historically has included things like projections for supportive housing needs, all of the information about the point in time count. And that process is supported by the city, but led by Homer Trust. And they do a lot of sector engagement and have existing, like through their CAB and their working committees, have constant touch points with the sector. So the city, in partnership with Homer Trust, leveraged those tables to bring the draft actions forward and say, is this sitting right with you? Are there opportunities that you see where your organization would like to partner with us to work on advancing the outcomes that we've identified are within our role and responsibility? What we didn't want to do was engage on something that couldn't be influenced by community because of the nature of that jurisdictional conversation that we were talking earlier. To Caitlin's point, people often say, and rightly so, like, is the city doing enough? And we didn't want to go out to community and be like, what do you think we should do? Without setting any riverbanks around realities around budgets and things like that. So the result was that we were able to leverage those existing conversations, which had resulted in the partnerships that Caitlin talked about with Montana First Nation, Enoch Cree Nation, and lots of other organizations that are working in community today.
Thank you.
We do have time for a couple more questions if there is anything.
Sorry, I'm looking to make sure no one else wants to ask a question first. I had a question for the Edmonton folks. How, I guess the onboarding, you're now in the training and stuff, like for example, where I'm in Montreal, so sorry if there's any city folks here. Sometimes there can be a plan, but not everybody is on board. So for example, at least where I work, there's been like a lot of resistance from the travaux publics, from the city works folks, about like because they have like quite a bit of union power, which is obviously great. So the union has kind of like thwarted, has blocked basically efforts for training on like on like picking up, consummation stuff. And anyway, there's like all kinds of blocks that happen from like a union or like a public works perspective. It could be other folks maybe that end up blocking somewhere. I don't know if it's because like you have the mayor on board who maybe is like, no, this is just like the way it is, or like how do you like move forward those conversations when there's like a lot of resistance from certain groups within the municipality, if that makes sense.
That is the $1 million question. So we, like with the training, I would say we essentially did a training analysis, because like one of the things is that you'll find is different departments have different levels of training. So like someone who is hired to do cleanup and encampment probably wouldn't get that much job training, whereas someone who is a municipal enforcement officer and is either like working in transit stations or working on parkland would, because they have special authority, there would be like significant training plans and requirements that they have to do to like keep their designation. And so essentially what we have tried to do is like infiltrate our way through relationship with people to say, what training do you do around like substance use or harm reduction or trauma informed, or like understanding why people are experiencing homelessness. And so trying to understand what's like currently happening, because some areas, for instance, like Edmonton Public Libraries has like a pretty extensive training that's like already developed in these ways. And then there's other places that don't. So one of the things that we've done recently is that we did a corporate-wide survey on what city employees would like to see in a training, and also how confident they feel in engaging with people experiencing homelessness. And do you feel safe? Do you feel like you have the tools? And we got pretty low results, like people not feeling like they have the skills and capacity. And we also got input on the area types of topics. And so we're trying to use evidence and best practices through training curriculums that have been developed worldwide to create something that's like really relevant. And so what we're going to do is we're going to build out 6 modules, and they'll be able to be mix and match depending on like the area that people work in, and what would be most relevant to the experiences or how frequently they interact with people experiencing homelessness. And then we have evidence from a corporate survey to sort of like convince people, like, because most people want their staff to feel safe and supported, and want them to, like, it's in our best interest for people to retain their jobs and feel confident around that. And so then we're sort of like using evidence to say like, well, we're hearing from your staff is in this area, they don't. And so like, we're here to help you. But I would be lying to you if I said it was like really easy and everyone's on board. Yeah.
The other thing I would add is that it's also a change management exercise. Yeah. And so like when you are building your plan, or if there is, like, I don't know if you're coming from like internal to the City of Montreal or what. Okay.
Really, like,
Okay, yeah. So like as an advocate, I think from the outside, you're like, yeah, it seems like pretty straightforward that like, I'm going to pick on peace officers, but I don't mean to, but like that peace officers should have some basic training and understanding like crisis and emergency housing response systems so that they can divert people from healthcare or justice systems like that. To us, like we sit in the, like we are the voice of in this room that's like, yes, of course, logical. But when you're having those conversations internally and you learn about all of the different like legal mechanisms that may prevent them from doing or saying or acting in a certain way in their job, you are able to gather that information and incorporate it into your recommendations in order to point to it and say, I recognize these challenges that you face and these limitations. Let's work together to figure out how we can land on something that works for both of us. And we did that through the engagement in developing the plan. So we were like in multiple rooms with multiple frontline folks having conversations about like the different way. We're not looking for you to be a housing worker. That's like not the ask here. The ask is to make sure that you're integrated with the rest of the system that you're probably already interacting with, but in a more proactive way. And so once we had been able to like have those conversations and build that goodwill, we were able to talk to their bosses and say, this is what we're hearing from your people. Here's what we have identified as a possibility. We don't think it's going to add to the workload. We can do all the work for you. Like it's very like we have taken it on. So like Caitlin has a staff person who is actually developing a curriculum from scratch. And so that will be delivered ideally corporate wide.
Any last questions?
May I make a really quick addition to your low barrier intake question? Because I was thinking about it and I gave you a very program-focused response. And so when you think about working with the municipality, a few other ways that we created a low barrier intake process while working with a coordinated access system is actually saying, hey, we know one of the barriers that's going to come up for somebody is if they have arrears with social housing in our community, it's going to prevent them from obtaining a unit. And so let's actually make sure that's part of the screening because we don't want people to get to the point of thinking that they're coming to intake and then we have to navigate this conversation. So also finding ways to do some of that pre-screen and then finding a solution for if there is existing arrears, how to take steps to address. So something like that. Another way would be a requirement for certain paperwork to be in. And so finding out, again, like what are the requirements within the municipal sector and then finding out how we can get creative within those requirements to say, maybe you need this application, maybe you need this tax document, and can we commit to doing that work actually with this individual in the first 3 months of their occupancy and get that box checked? Yes? Okay, no problem, right? Because those are the things that create barriers. And then no wait lists. So a commitment to say, meaning when we did initial call for referral, we're only asking for 24 names because we only have 24 units. And if somebody's not able to move in, then we select another name. However, unjust in my own opinion to select 40 names for 24 units, recognizing that there's many folks who won't obtain a unit through that. So those are 3 additional ways, like on a more practical side, while working with the municipality to create low barrier.
Hi there, this question is for Edmonton. I believe, if I heard you correctly, you said there's a phone number people can call if they're in crisis but don't need an ambulance. And I was wondering if you could talk a little bit more about that.
Yeah, so the city funds an organization called Reach Edmonton, and they run, it's called 24/7 Crisis Diversion, and it is, you call 211 and you press 3, and it essentially diverts you to a call center. So if you're a regular citizen walking down the street, you see somebody having like a psychotic episode or walking around with no shoes or sleeping in a bus station and you're concerned, or even they've asked for help, but you're like, I don't, like, what am I supposed to do? Like take you in my car, drive you somewhere? You call this number and they dispatch, it's like a van with 2 workers, and they will come, you say like, I'm at this street intersection, they come, they assess the individual to make sure they're not in like medical distress, and then they'll ask them like, do you have a safe place to go? Do you have a home? Or do you want to go to shelter? And then they transport them to somewhere safe. So it was really meant to prevent people from calling 911 and getting police or EMS to respond to situations that didn't need to. So, yeah.
Any last questions?
Yeah, I had a two-part question. One was for Edmonton to follow up on something you mentioned in Hamilton. My question was about accountability. So some of the things you mentioned, like I'm thinking, for example, trainings, and in a workspace, a lot of trainings are like you just kind of click a slideshow and then you check the box, right? And so that doesn't actually mean that someone is qualified or like interested or actually held accountable, for a certain standard of work.
Yeah.
So anyway, so I guess I was kind of wanting to ask if you could follow up a little bit about the accountability framework in the partnerships. And then for City of Hamilton, it's kind of following on the jurisdictional question. I would be curious if you could share a little bit about, like how you made this program happen in the context, I guess, of Ontario and your roles and responsibilities and how, if you could elaborate a bit on that. Thanks.
Yeah, so to roll out our training, we're not doing it's not going to be something you can do online. We're not filming it, so it will be a training that we deliver in person. And so like we'll go to work sites and deliver it to a group of people. We're going to potentially do some virtual ones, but it's all going to be like live in-person training. And then the other thing to the measurement component is that following the training, we will send people a survey. I believe it's about 30 days after to ask if they have implemented or used anything from the training as part of their work, and then get feedback. Because to your point, like we could say like we've trained 14,000 people at the City of Edmonton, and if no one implements anything or like uses anything, then you're like, well, have we hit the right topics? Or so that will be sort of like the post training evaluation that happens.
And just on like a bigger scale of accountability, I would just say we had two things really going for us on this plan. The first is having a city audit of a service is like initially terrifying. Tremendous opportunity, because they are on your side looking to make city services better, and they are observing your program development in response to the audit, at least at the City of Edmonton, and keeping a public-facing dashboard for the public and for councillors to ensure that you have done what you said you were going to do. And so the performance measurement framework that exists now as a part of the plan is a part of that public-facing accountability to support the goals that we outlined in it. And so I would just say that if you're ever in a position to get your council on board via bringing a plan on homelessness or housing to them to get their approval, it gets that direct line of sight on it, which allows for greater accountability across a corporation, even if it's being stewarded mainly by a single business area.
Hi, I can respond about how this permanent supportive housing came to be in Hamilton. So something that I didn't touch on is that it was a collaborative effort in capital funding from all three levels of government. And then there was also an intentional commitment at the municipal level through our council for the ongoing operations of King William.
All right. Thank you to our presenters today. Thank you for everyone that attended. I love the leading with curiosity and moving forward in collaboration to end homelessness. So I will allow you to have about a half an hour, and then our last keynote speaker is Jessie Thistle. Thank you for everyone who's attended the conference, and have a wonderful rest of your day.